Electroencephalography. Electroencephalography is a method of studying the brain based on recording its electrical potentials. The electroencephalographic signal is an integration of neuronal activity on various spatial and temporal scales. Now let's study the main characteristics of electroencephalography. The first one is frequency, which is determined by the number of oscillations per second. It is written down with the corresponding number and expressed in hertz. The second one is amplitude, which is the range of electric potential fluctuations on the electroencephalogram. It is measured from the peak of the previous wave to the peak of the next wave in the opposite phase. Estimate the amplitude in microvolts. Here you can see the measurement of frequency and amplitude on the electroencephalogram. The next characteristic is the phase, which determines the current state of the process and indicates the direction of the vector of its changes. Waves of different frequencies and individual peaks can appear at the same time on different levels. Then they are called in phase. Firstly, when you ask your patient come in, you can ask him to sit down on the couch and clean your hands with the antiseptic. Then put the electrodes on the patient's head, as in the video. It's important that the electrodes are firmly attached to the skin, so a more accurate and right result will be obtained. After it, connect electrode wires with color coding as in the video. So you see, the first one is white color, after it goes red one, and the black color is the last. Before starting the registration, ask the patient to relax. Start the program Biopack Student Lab. Choose the lesson number 3. As file name, type the name, surname, and the number of group and faculty of the patient. Then click OK. This will complete the installation process. Then we move on to the calibration. The calibration process will stop automatically after 15 seconds. To register data, press Record. Registration should take about 30 seconds. The doctor asks the patient to change the state of his eyes every 10 seconds. If everything is in order, click Done. Now disconnect the clamping pins of the electrical cords. Discard used electrodes and throw them into the bin. Now you need to transfer the data to the flash drive, whose memory should not exceed 2 GB. Insert the flash drive into the computer's USB port. In the lower left corner of the screen, click on the Start button and type the file name in the search bar. Copy the folder and transfer it to a flash drive. Please note that you cannot just transfer the file. You must firstly copy it and then paste it into the flash drive. There, in the same way, open the Biopack and select the desired file. Press the Open button. Then you need to set all the parameters as in the video. In order to register the results, you need to select the corresponding area and you will notice how the parameters have changed in the upper part of the window. So, it's necessary to repeat 3 times. Now we start analyzing the rhythms. The first one is alpha rhythm. The frequency of the alpha rhythm is in the range from 8 to 14 Hz. The amplitude is from 30 to 70 microvolts. The amplitude may decrease with age. It manifests itself in more than 90% of healthy people. The alpha rhythm has the highest amplitude recorded in a calm state of a person who is in a dark room with his eyes closed. In order to register the data about alpha rhythm, please follow the steps as in the video. The beta rhythm has a frequency of 13 to 30 Hz and amplitude from 5 to 30 microvolts. Occurs when the patient is active. For registering the data about beta rhythm, please do the following steps as in the video. Now we move on to delta rhythm, which is from 1.5 to 4 exhalations per second. The amplitude is from 50 to 500 microvolts. This rhythm occurs during deep natural or narcotic sleep, as well as in coma. The delta rhythm is also observed when electrical signals are recovered from areas of the cortex bordering on the area of traumatic focus or tumor. Long amplitude oscillations of this range can be recorded at rest during certain forms of stress and prolonged mental work. The next rhythm is gamma rhythm. Then this indicates the presence of the disturbance in the activity of the brain, as a result of which the patient's cognitive abilities are reduced. Gamma rhythm is observed when solving problems that require maximum concentrated attention. The last one is theta rhythm. Theta rhythm is most pronounced in children from 2 to 5 years old. This frequency range contributes to deep relaxation of the brain, good memory, deeper and faster assimilation of information, awakening individual creativity and talents. Now please fill in the data which you have gotten during your work into the protocol. Thanks for your listening. We wish you good luck.